NO3, which is to understand the impact of contemporary health and social care issues on the development and provision of services. One, we are going to analyze the impact of the contemporary issues in health and social care, and then two, to analyze the implications of the contemporary health and social care issues on the development of services to meet those population needs, to be able to achieve a merit qualification. You should be able to assess inequalities in current health and social health and well-being needs of the population. And then lastly, to be able to achieve a distinction, we should go beyond evaluate the successes of health and social care services in meeting diverse population health and social care needs. These are things that we expect them to do this lecture. For LO3.
LO3.
Let's see. Do you have chance to read before lectures?
Not all. It's not all. What time you say?
So obviously, as I've mentioned, we are going to look at the impact of the contemporary health and social care issues in the development and provision of services. So we're going to generally look at how those contemporary issues influence the needs of population groups in health and social care, and also look at the implications of those influences. So to identify those contemporary issues, you have to begin by identifying the key contemporary issues in health and social care relevant to your chosen national context. We did mention that yesterday, the mental health issues, inequalities, the aging population, working issues, and all that. We mentioned that. And we also mentioned that we were to examine those health outcomes. You should be able to analyze how the contemporary issues impact the health and social care disease burden with the population, assess the changes in mobility, mortality rate, life expectancy, disability rates, prevalence of chronic diseases, and all that. Should be able to examine all those. And then also consider the direct and indirect pathways through which contemporary issues influence physical health, such as exposure to environmental illness, lifestyle factors, healthcare access barriers, or disruptions in healthcare services. Okay. That's in the examination. Those are the things you have to identify. Then you have to be able to assess them as well.
Okay.
So in assessing mental health and well-being, in assessing, then you're trying to do what we call evaluation of those impact that you have examined. Analyze those mental health issues, stress levels, depression, and all that. If so be that you may have some of these things within the national context of what you have examined. You have to consider the availability and accessibility of mental health services counseling in Ghana. They are now trying to, they've now had a mental health, what do you call it, office, and trying to put things in place, okay?
Yeah.
To help for mental referrals and all that. They are not trying to do that because in Ghana, most of the mental health people, they always take them to what we call pantai.
Yeah.
So, but it's not every sickness mental health thing that you have to take people to pantai.
Yeah.
The UK is not like that, isn't it?
Yeah.
There are those who are giving support, they are rehabilitation centers and all that.
Yeah.
By Ghana. So these are things that you have to identify and address them along the line. Okay.
Yeah. Okay.
Same with other countries. Once somebody has any mental disorder, they get them to listen. That should not be the case. It's not every case that needs to be referred to a mental health center or something. That exploring social definition of health. Examining how contemporary issues intersect with social determinants of health to influence well-being. Assess the role of economic factors, housing condition, education, employment, social support networks, community conditions, education, employment, social support, and all those. We're trying to explore if there are more issues in those areas. We have to explore that there are more issues and consider how inequalities and disparities in social determinants attribute to differential health risk, vulnerabilities, and resilience among population groups affected by issues that you have explored more in that regard. So, in other words, you're not limiting yourself to only one or two particular issues, but then you have to explore more.
Okay.
People
will be coming in here today. I think so. A few.
And exploring more, you have to look at the role of the socioeconomic factors, which involves housing, education, employment, social support networks, community resources, health outcomes. And then we have to look at how inequalities and disparities in social contribute to different health risks, where vulnerabilities and resilience are more population
dinners. Or you make them a bit.
We have to also look at analyzing them.
This is my little room, isn't it?
Analyzing them. We need to analyze those health utilization and asset. You have to evaluate the changes in health utilization of patronism and access to service resulting from contemporary issues, access barriers to accessing healthcare, such as financial constraints, geographic disparities, cultural barriers, language barriers, or stigma associated with certain health conditions. You also have to look at the impact of the healthcare system capacity, resource and constraints, and disruptions in service delivery on individuals' ability to receive timely and appropriate care for their healthness. Okay, so that's what we call analyze. You know, we are trying to analyze and see that if those changes within the healthcare results to addressing those contemporary issues, where access to barriers to access healthcare, such as financial constraints and all that we are looking at. In those analyzing, we're looking into consider the impact of those health system capacity and making sure that the appropriate care needs are met. In care, we call this person-centered care. Okay?
Person-centered care.
Then we have to look at the vulnerable population. Pay attention to the unique needs and vulnerability of specific population groups. You know, affected by the contemporary issues. You may realize that upon your examination and then analyzing, maybe it is the aging community that is getting more dementia, okay?
Dementia,
Or
yeah.
the younger generation that is getting. So you have to pay attention when you are analyzing, coming back with your conclusions. Okay.
Okay.
Analyze our factors such as age, gender, race, ethnicity, disability, socioeconomic status, or immigration sectors intersect with health, social care needs. Consider the differential impact of contemporary issues of vulnerable populations, including children, older adults, individuals with chronic illness, people including children, older with chronic illness, people experiencing homelessness, refugees, migrants, and marginalized communities. We therefore have to evaluate the resilience and adaptation. We mentioned that yesterday, that you have to adapt when you are coming out, when you have made conclusions and determinations, you have to adapt.
Adapt, yeah.
I mentioned that. Okay?
Yeah.
So areas of resilience, because when you have considered the socio-economic cohesion, leadership, innovation, enhancing resilience, and facilitating recovery through health and social care changes. Of course, when you have adapted or explored, you need to explore coping mechanisms, adaptive strategies, and community resilience. Of course, you need to do that. Then, in utilizing this data record, yesterday we spoke about how data played a major role, because out of data,
That's nice, was it?
we do what we call
Yeah. Oh, it's what you were there. I didn't know.
we do what we call qualitative,
That's right.
quantitative, and exploratory. So,
What time is the dinner at? Probably 12 o'clock.
so
Yes.
what you look at is when you have brought out your evidences from what you have analyzed and explored, you need to use those evidences, incorporate them to a data-driven insights. Okay.
Yeah, okay.
Where your research findings, put them into assessment and support evidence-based policy decisions, resource allocation, and intervention planning, of course. So whatever you have gathered from your research through questionnaires, through surveys, through feedback, you have to make sure that you channel them to assessment where you can use those to affect the policy decisions in organizations or in the country, or resource allocation or intervention planning that will help the problem that you have identified. Okay. Okay. Any question at all?
No.
No.
Yeah, I'm alright. Yeah.
Okay. Then let's look into identifying the contemporary health social clinics. which we've spoken about already. But we are going to look into the analyze those implications. So let's look at changing population needs. So once we want to analyze how the contemporary health and social care issues are shaping evolving needs of the population, consider the demographic trends, epidemiological patterns, social determinants of health and emerging risks that influences demand for services. Explore how changes in population health profiles, prevalence of chronic conditions, shifting care preferences impact the types and levels of services required to meet diverse population needs. Okay, do you understand it?
Yeah.
What's your understanding?
Assessing the population is you need to assess the population. Let's say and see. Let's say you are assessing the population and see the number of people who have mental issues,
Yeah.
like let's say dementia.
Yeah.
Yeah. So if you assess the population, you have to know maybe older people have maybe 50 of older people have dementia.
Yeah.
And maybe 20 of children or young people also have dementia. So if you assess, you know how it's balanced.
Okay, so let's look at evaluate service delivery models. Assesses existing service delivery models and care pathways within health and social care. Of course, we should be able to assess, which is very important, if the service that we give are top notch or they are falling behind their quality. So you need to assess those delivery models and pathways within the health and social care systems. Evaluate the effectiveness, efficiency, and responsiveness of current service operations in meeting population needs and addressing contemporary challenges. Consider the integration of primary care, specialty care, preventive services, mental health support, social services, and community-based interventions in comprehensive service delivery methods. Identify gaps in service deficiencies. Identify gaps and deficiencies in barriers in the availability, accessibility, and quality of health. Of course, you should be able to identify those gaps, those anomalies, those things that you feel that they are huge space.
Where are you from? Ghana.
Very-
Lovely place. Nice place.
You should be able to analyze disparities in service provision, geographic and variations, waiting times, affordability, linguistic and cultural, and coordination of care. Okay, so admitted those gaps and service efficiency. So if you realize that by assessing the nation's service delivery towards self-care, there's huge gap. There's this uniformity in terms of service delivery. You need to identify those gaps, and then you need to then address it. Okay, and those gaps could be the affordability of or waiting times that people have to wait before they are attended to in the UK. The NHS is the same. You have to wait for a long time when you get to A&E and all that. Those are all things that you need to look into and address. And then you have to explore more innovative solutions or remedies to these things that you've identified, what we call the best practices. Innovative ways of doing things. If the waiting time is taking long or manually, you can devise a new technology where people just come in, they can log in from their home before they get to the hospital. Okay.
Yeah.
Yeah. So just to make sure that you are trying to cut off waiting time when people have to wait for a long time before they attend it. You have to consider from lesson learned, things that you've learned, lessons that you've learned, consider them for successful intervention, pilot projects, and demonstration programs that demonstrate effectiveness of meeting population needs and improving their health outcomes. So you will therefore need to ensure that wherever things that you've learned, what we call learning, lesson learned, and data or information, you make sure that you plug them or include them in decision making on the demonstration programs that you do. You have to make sure that wherever you do in that context of the lesson learned, you are able to use them to improve their health outcomes and what we call the best practices. Doing what is the best quality thing that you, the best ways you have to do things that will improve, that will bring improvement. Okay, yeah. So we call it best practices. You can't just do anyhow. For instance, if somebody comes to a company, you should have what we call, you know, to check for security purposes. Anybody that goes to a company should be able to log in or write their name as a visitor so they can keep records of those who have come in, that the time they come in, the time they leave. Okay.
Yeah.
And on this side, these are all called best practices. Sign in on about it. Probably manually, if people have to write their name and sign in, maybe it takes time. Okay.
Yeah.
So you can come with a strategy where people, you don't need that. You just come in, there's something fixed in your entrance that they can log in. They can log in with that. Okay.
Yeah.
That's more faster. They can just log in, type their name, and they can log in or attach something to their ID card, something to the
ID,
to
yes.
show. Exactly. Okay.
Yeah. Okay.
Rather than going to the manual, they have to write their phone,
Right.
see who they are going to meet and their time they came in and all that. Okay.
Yeah. Okay.
Promote prevention and health promotion. Okay. So prioritize prevention and health promotion strategies aimed at addressing upstream determinants of health and preventing the onset of preventable disease and conditions. Emphasize early intervention, health education, lifestyle modification, and population with initiatives to promote healthy behaviors and reduce health risks. Consider the role of public health campaigns, community engagement, school-based programs, workplace wellness initiatives, and policy interventions in promoting population health and reducing the burden of healthcare services. Address workforce challenges and capacity. So where you are addressing the workforce challenges and capacity constraints within the health and social care systems, you then invest in workshop development. Of course, you want to make sure that the issue that you have identified, you are making sure that your stakeholders, which are your workers, you are building them to certain knowledge so that they can help in addressing the issues. So you have to do a capacity building, invest in workforce development, training program, professional education, and recruitment strategies to build a skilled, diverse, and resilient workforce capable of meeting evolving population needs. Consider innovative staffing models, task shifting approaches, interdisciplinary collaboration, and workforce retention initiatives to optimize human resources and enhance service delivery capacity. Okay, so
Okay.
consider innovative staff models, task shift approaches. So you are now doing what we call enhanced capacity building. You are building your staff to come to terms of those changes so that they can help address those things internally. But also doing that, you also come up with new innovative ways of doing things. You know, if staffs are clocking in, they are coming, they are clocking in with the writing way of clocking and becomes a problem. You come up with strategy where clocking becomes very easy with just using the ID card or something. Okay, so these are all things that you have to look into. You know, how they put information. If these days, most of the hospitals, they don't use writing, they have iPad.
Yeah, like I was like
And you
in
have iPad, exactly.
in our agency, at first they used to write, but now we use a care planner. Just you log in your phone.
Exactly.
You do your notes, everything there.
Exactly.
Yeah.
Exactly. Same with hospitals and all that.
Yeah.
Same, yeah. So in the past, it was more manual thing. But so these are all things that you do as capacity building to meet and make things faster to help your service delivery. So this everything is on the computer. You type and you use your phone and you send it and you're good to go. Okay.
Okay.
And, you can now strengthen collaboration and coordination. So when you have done that, you have to strengthen collaboration. We spoken about stakeholders, you know, to involve government agencies, healthcare providers, and all that. We've spoken about that, you know, and so it helps in coordination, case management, multidisciplinary. I mentioned that the last time, multidisciplinary teams, where I said one there's a safeguarding issue raised in the care home or supported living. Everybody, they are different. Council may have somebody coming from the safeguarding team, we may have police involved, we may have social workers involved. That's what we call the multidisciplinary team. Okay.
Yeah.
So we also have to look into ensuring equity and accessibility. And once you say equity, the first thing that comes to your brain should come to your mind is talking about fairness. Okay, equality. Okay. So making sure that there are equal distribution or equal social care distribution among patients, service users, and within your care home as well. Yeah, making sure that you address any disparities in service provision, that making sure all provision is divided equally among those that need them. You know, so and consider strategies for reducing those health inequalities, promoting social inclusion, and tailoring services to meet the needs of diverse population, including vulnerable and marginalized groups. Okay. So these are things that you have to take note of. The last data, that's we've spoken about it. So let's crack on. Identify health indicators. So we give identifying key health indicators relevant to your chosen national content, which is life expectancy, infant mobility rates, prevalence, chronic disease, and all that. And then compile data on these indicators from reliable sources such as National Health Service, vital statistics registries, disease registries, and administrative database. Okay. So when you have done that, then you can look into evaluate those socioeconomic inequalities. So you've seen that one of the indicators are inequalities. How do you evaluate them? You have to assess socioeconomic inequalities in health and well-being by examining the impact of income, education, occupation, and wealth on health outcomes. Evaluate the disparities in access to healthcare services, preventive care, and health promoting resources based on socioeconomic status. Use the measures such as income, quantities, education levels, and occupational categories to stratify health indicators and identify socio-economic variance in health outcomes. So, in evaluating socioeconomic inequalities, you are looking into the work itself, the disparities in terms of salary. They're going to look into help providing resources based on socioeconomic development, the educational levels, the occupational categories, you know, what kind of job they do, what levels are they on. If people are on the same level, why is one person earning so much than the other? And all the things you have to look into.
Injections in the neck and things, you know. I don't
You have
need
to
that.
examine the racial and
I have got no
disparities.
pain, you get me? I have no pains at all.
Examine the racial and ethnic disabilities in health and social care outcomes
Thank you.
and access to care analyze difference in disease prevalence, mobility, healthcare utilization, and quality of care between racial and ethnic minority groups. And the manager, what we call BIM. So the BIM is called the British African and Asian. Okay,
Sure.
yeah, British, British, um, social and black and Asian and ethnic black minority, black minority. We consider it. So these are all, you have to look into examining all these things, differences in the ethnic disparity, health outcome, access to care, another differences in disease prevalence. It is said that a lot of obesity is among black people, and all
Yeah.
that, and a lot of cholesterol and all that. So these are all things that we need to look into and examine. Okay. Then we have to look into access to geographic disparities. The geographic is very important. Evaluate the geographic disparities in health and social care needs by comparing health outcomes, access to healthcare services across different regions, whether urban or rural areas and neighborhoods. Therefore, have to analyze the variations in health infrastructure, health workforce, distribution, healthcare resources, and environmental focus. Consider the impact of social determination of health, such as housing quality, environmental pollution, access to healthy food, transportation infrastructure, and neighborhood safety on geographic disparities in health outcomes. So you are looking at the various regions, whether urban region, wherever they look, we are comparing, checking, and seeing if whether regions or regions they are fair or things are going on properly across. Not that one region is having more opportunities than the other.
Yeah.
Yeah, you have to consider the gender disparities, of course. How many women are getting those opportunities? Are the men getting more than the women? Are the young girls? So these are all things that we need to look into gender base and making sure that women are also having their fair kind of treatment and not that the men are being treated more fair than the women. Yep. So you have to look into evaluate access to healthcare. Are people getting enough access to the healthcare that has been provided? Those are things that you have to look into. What is preventing them from getting that? Is it financial barriers? Is it cultural barriers or is it structural barriers? Why are the people not getting access to healthcare? What are the reasons? Is it money wise? The right distance? Is the hospital too far from where the people are? Are they have to travel from the rural areas to a city before they can access an hospital? So these are things that we need to look into. Okay, then we have to look into the utilize health equity framework, apply health equity frameworks and article tools to query inequalities in health, social care well-being systematically. Consider frameworks such as the social determinants of health (SDH) framework, the health equity impact assessments HEIA framework, and the process plus framework list of residence, ethnicity, culture, unpaid occupation, gender, sex, religion, education, socioeconomic status, social capital, as additional factors. Use these frameworks to identify priority areas for intervention, monitor progress by reducing health inequalities, and promote evidence-based policy actions to address those disparities.
Okay.
So we are looking at utilizing the health equity frameworks. Health equity frameworks. We are utilizing them. Yeah. So let's crack out. Any questions at this moment?
No, I don't have any question now.
Are you sure?
Yeah.
Okay, so let's proceed. Engage communities and stakeholders. What's your take on that?
Engage communities and stakeholders. I think you have to engage your community, like the community that your agency, let's say you are agency, you stay like you are agency like Hackney. I'm using my community as an example, as like Hackney now, and I have an agency here. I have to engage the communities and assess them. Me, the agency, let's say I will be the stakeholder to engage the peoples in the community. Maybe I can go to maybe Homerton Hospital. I have to register there. So in case of any vulnerable person who is there, like maybe who needs help, like a carer or a support living person, they will just contact me, the stakeholder in the community, and I will take them as my client and give it my carers to work on them.
Okay, that's good. That's good. Okay. So you can also look into advocates for health equity. Advocate for health equity and social justice by raising awareness of health inequalities, mobilizing political support, and promoting policy reforms. Use data and evidence from the assessment of health inequalities to advocate for targeted interventions, resource allocation, policy changes aimed at reducing disparities and providing population needs. Collaborate with policymakers, advocacy groups, civil society organizations, and healthcare providers to develop and implement strategies for advancing health equity, promoting social inclusion, and addressing the root causes of health inequalities. These are things that you need to look into just for advocating for health equity. So you are essentially what you're trying to do is that you are trying to stand for justice by using awareness of health inequalities and mobilization. So you advocate. Once you see unfairness within the healthcare, you need to raise awareness. Okay.
Okay.
Some of those awareness may be still blowing. Okay.
Okay.
And some of the awareness is that you can even train your staff. Okay.
Yeah.
Some of the things that you have seen which is wrong. Exactly. Then we have to look into success metrics. You see, we spoke about the matrices that we use as a measure to look at whether you're being successful with our evaluations and analyzing or not. So analyze health outcomes. Evaluate health outcomes achieved by health and social care services among diverse population groups. Analyze changes in population health indicators, disease burden, mobility rates, life expectancy, and quality of life to assess the impact of service on improving health and well-being outcomes. Stratify outcome data by demographic factors such as age, gender, race, ethnicity, socioeconomic status, geographic location, and disability status to identify disability disparities and variations in health and outcome across population and subgroups. So we have to evaluate health outcomes achieved by the health and social care services among diverse population groups. Analyze the changes in population health indicators, disease burden, and all that. We have about a lengthy chapter about this. If you were to assess the access to care, we mentioned that as well. Okay?
Yeah. Yeah.
So that's so. Evaluate the service like utilization engagement. We have mentioned that as well. We have to evaluate those, how people are utilizing it, and also engaging to know that you are on track with those things that you are providing, and people are adhering to treatments and all that. Okay. We also have to analyze factors influencing service utilization, including awareness of services, cultural beliefs that we have mentioned. Asset patient experience and satisfaction. Again, that's what we call feedback. Okay.
Yeah.
You can only do that when you have effective communication with patients and then creating that environment. Patients can speak out, okay? When
Okay.
there's something wrong with them, they can speak out and all that. And you're allowing patients what we call in care choice, isn't it?
Choice, yeah.
Choices to make decisions
To
on
make
how. So they are able to
decisions.
communicate with you so you can see if you're on track or not. And then equity in service provision. You mentioned that if there's any division of any service, it should be equity, okay?
Yeah.
Same allocation, with times, treatment options should be same for all. You don't treat one differently than another. Everything that you're asking or you want to do delivery, it must be the same resource allocation, same treatment option, outcome based, or everything that you do should be the same. Use measures like concentration indices, Gini coefficients, and equity gradients to quantify inequalities in service provision. So these are tools that they are saying that you can use also to quantify that. We must also consider the cultural competency and inclusivity. You can evaluate the cultural competency and inclusivity of health and social care services in addressing the needs of diverse populations. Assess the extent to which services are culturally sensitive, to diverse beliefs and consider the initiatives such as interpreter. So once you see people are struggling, they may have issue with even their dialect or their language. You have to devise ways where you can help, and that one of them could be interpreters. Okay,
Yeah.
training for healthcare providers, community outreach programs, patient declarations, materials, and all that. Okay, we also assess a cost effective. You mentioned cost benefit analysis yesterday. Okay. Yeah, so
Yeah.
evaluate the cost effectiveness and efficiency of health and social care services in delivering positive health outcomes. Assess resource utilization, healthcare expenditure such as delivery models, and cost-saving interventions aimed at optimizing health outcomes within available resources. Consider economic impact of the method, such as cost benefit, analyze cost effectiveness analysis and return on investment on calculations to assess the value of service in relation to their impact on population and health well-being. Utilize data and evidence practices. Utilize data and evidence-based practices to inform the evaluation of health and social care services. Draw an epidemiological data, health information systems, patient records, to funding to assess the service effectiveness and inform decision making. Incorporate best practices, clinical guidelines, evidence-based interventions into service delivery to ensure that services grounded in scientific evidence and aligned with recognized standards of care. So it's all talking about making sure the best practices that I've mentioned about, okay, making
Yeah.
sure their best practices, the clinical guidelines are followed and all that, okay?
Yeah.
Engage stakeholders and community partners. We've spoken about that, haven't we?
Yeah.
So in conclusion, that's what we have done for today. Okay.
Okay.
Any question? The references are your model. So should now start looking at the questions, okay?
Yeah.
Yes.
Okay.
So Monday, instead of having assignment discussion, you have to have instead of having level 3, instead of having you need to have another link for assignment discussion because we use that for level 3. So I'll tell the office to send another link. Okay.
Okay. All right.
So next meeting will be Thursday, am I right?
Yeah. Thursday.
I'll tell the office. Okay.
Okay.
Take care.
All right. Thank you.